Welcome to Connecticut eHealth Podcast, educating, conversing, and connecting for better health. The Connecticut eHealth Podcast is a space where we get together with local and national experts, key stakeholders, and other individuals in the space of eHealth to discuss health information in Connecticut and around the country. This podcast is brought to you from the UConn Health Interoperability, Innovation, and Learning Lab, where our mission is to promote the optimal adoption and use of eHealth by providing education and engaging in conversation with leaders to create connections for better health. So let's sit back and get connected. Hello, this is Tom Agresta. I'm a family physician and clinical informaticist at the University of Connecticut, and I'll be your host for this episode of the Connecticut eHealth Podcast. Today's guest is Dr. Stephen Burrows, Chair of Health Sciences and Leadership and Program Director of Healthcare Informatics in the College of Health Professions at the Sacred Heart University. His educational background includes a doctor in podiatric medicine from Barry University and an MBA from Sacred Heart University. Dr. Burrows is a certified professional in healthcare information and management systems and a certified professional in health information technology. Thank you for joining us, Stephen.
Thanks, Dr. Gress. I'm glad to be here and talk a little bit about our program and informatics as well.
And as a disclaimer, I actually do know Steve from prior life when he was a practicing podiatrist in the clinical setting where I would refer patients to him. So it's a good to have you come kind of full circle and have the opportunity to join us today in a new role that you've been doing for a number of years now. So tell us a little bit about yourself, your background, and what brought you to the area of healthcare informatics.
If I could reflect a little bit of what you just mentioned, which is that we worked together in the past. And I think that's very indicative of healthcare informatics, which is that folks work together for the betterment of patients. So we take care of our patients. We're in healthcare. As you mentioned, your background in primary care, and now working together in the informatics realm. And that really, to me, is what healthcare informatics is about. Essentially, what I always talk about or use as a definition of healthcare informatics is the putting together technology and healthcare. So how do we use those two to better the patients? My background really reflects that as well. As Dr. Gressler mentioned, I'm a podiatrist by background and training. I practiced for a number of years full time and then moved into healthcare informatics just over 20 years ago, working for a local hospital and then a number of different organizations throughout the state of Connecticut with different roles, both in the large healthcare system, the outpatient setting, as well as in the small hospital setting. And all of those were focusing on how we essentially leverage technology for improving care of patients, for ensuring their safety, and what can we do for the betterment of our patients.
So excellent. So in your current role, tell us a little bit about what you do in your current role.
So I've been at Sacred Heart just over 10 years, and I was hired as the chair and program director for healthcare informatics to oversee the launch of our graduate program, our Master of Science in Healthcare Informatics. And it was brand new for the university. I was brand new, and I worked with my university partners to develop the curriculum, to develop different opportunities with partners throughout the state of Connecticut, to develop the courses, to hire faculty, to essentially recruit students and get the word out throughout the state of Connecticut and the area, as we're an online program, about the program and the benefits of informatics in healthcare and the value that we can bring to healthcare. I started around the time when meaningful use was really pretty important, and it dovetailed very well with the value that technology brought to healthcare, implementing EHRs, using mHealth or mobile health and other technologies for patients. So we have admitted students through the last 10 years and evolved throughout that period of time for what our curriculum consists of.
And how many students do you have currently in your program?
Currently, as of today, we have about 180 total students, and that is divided between two areas of our program. We have a fully online program, which is typically our part-time working adults who are working in healthcare or other fields and desire to work in informatics. So they are coming back part-time to grad school, take classes online or asynchronous online, and they finish their degree typically in about 2 years. The other larger sector of our program is our in-person, full-time international population of students, and that's the majority of our students currently, and they finish in a little bit more than a year, about a year and a half or so. So we offer classes in both in-person and online formats. Students can move throughout, meaning they can take one or the other modality, but essentially they're either part-time or full-time students. And the full-time students obviously are full-time grad students. They're here with us for full-time classes.
And you mentioned that you're doing an international program. Is there a large cadre of folks that come from outside the U.S. for the program?
Probably about 80% of the total number are international students, and current students are representing India. For the most part, that's the biggest portion of our international students, but we also have students from Nigeria, Taiwan. We've had students from Egypt, Nepal, Ivory Coast, Cameroon, and I'm forgetting one other. Saudi Arabia was the other large group of students we've had in the past. So pretty varied group of students that come into our classes.
So really, you're spreading the skills of healthcare informatics throughout the whole world.
Definitely, and we I mentioned meaningful use. That has been a big support, a big motivator for using technology in greater ways across healthcare in the U.S. That type of a program where the funding is provided as a bonus sort of dollars provided by the U.S. government. That's not comparable in other countries globally. And many countries, including India, are at least 10 years behind the US in using technology, using electronic health records in healthcare. And so the students have an opportunity to come over, learn our curriculum, and then bring them back to their countries. Especially the Saudi Arabian students are involved in many different projects. I see their updates on LinkedIn and the health ministry projects that they're involved in. So yes, that is globally spreading the word of informatics is one of our focus.
Wow, so that's really kind of interesting. And my guess is that you use a lot of like simulation training and electronic health records and having people get hands-on tactile experience. Can you talk a little bit about that?
Sure. The hands-on approach is actually a tenet of our program. Because informatics is very much of a practical approach to solving the issues of healthcare, we also adapt and try to include as many of those types of approaches in our classroom, whether it's physical classroom, in person, or virtual. And by that, I mean that for assignments, for student work, wherever possible, where it's feasible, sometimes it's not always, but wherever so, we have something that they do, and an activity, meaning something that they would do that's a simulation of they're going to be doing in their field. And the academic EHR is actually an example of that. So we've incorporated not only in the program here, the healthcare informatics program, but actually across the College of Health Professions, which is our clinical programs. The PT, OT, speech, and PA programs are also using an academic EHR. So I'm sure your listeners are familiar with an EHR. The academic piece is essentially an area where a student can use and learn in a safe manner. And that's one of the definitions of simulation training, which is learning and doing skills and activities that somebody or a student might do as a future clinician in a safe environment. So they have the opportunity to learn from their mistakes, to conduct the activities they might. So things like drawing blood or taking a blood pressure. We do this in a sim lab to get the students comfortable with those skills. And they're not going to harm somebody if they're in a sim lab working on a mannequin. We replicate that with the academic EHR in that this isn't a real EHR. There aren't real patient data, so they're not so intimidated by the overwhelmingness, if I could say that word, of the data and the information, nor are they concerned about putting something in an EHR or deleting. So they get to learn in a safe environment what the features and functions are of an EHR. So again, I mentioned some of our clinical programs, but specifically for our program in informatics, we have them work through the EHR in several semesters of being comfortable with the EHR. So looking at data entry, data creation, and then also on the back end, which is the data analytics. So extracting data and then analyzing it. All again within that academic EHR setting. So the students get comfortable before they move out into their careers.
That's a really wonderful sort of applying, a skill that you're going to then have to use in your career. One of the other things that I think you and I both recognize, and is really widely recognized in the clinical informatics space, is that an awful lot of the work that we do requires soft skills, management and interpersonal skills. What kinds of things do you do in your program to kind of foster and teach people about that?
That's a really good point, because while we think of information technology as maybe hard skills like coding or understanding technology, there is more to that. And we expect students that are in a master's level program will eventually work to and assume a management level position. So not only if they're at the point of being a manager or director, but even in between, sort of before that period of time, they do need the soft skills because they're working on teams. And there are several classes where we teach a little bit about leadership. There's specifically one course, which is healthcare operations, which talks about and teaches them the environment of healthcare, our environment of safety, and other areas that are working in the not so hard skills. So as you mentioned, the softer skills as well in understanding what it means to be a part of a team. We also use group project work in almost every one of our classes. So the students have an opportunity to work with others. And from my philosophy in creating a group project, I often will randomly assign students to a group as opposed to allowing them to choose the group of students they work with. So they're not always working with their friends. They're not always seeing seeing one perspective that they agree with, that they need to see other perspectives of solving a problem. So randomly assign them to a group where they don't necessarily know the other group members gives them the opportunity to work with others to simulate again what it would mean to be on a committee, let's say in a hospital, where you don't and often don't choose the people you work with, but you're together working to solve a problem. And so again, sort of building that appreciation of others' perspectives, respect for others' opinions, and working together as a group to solve a problem.
Yeah, that's certainly something that anybody who's practiced in clinical informatics, healthcare informatics, will tell you is really critical, because your team members and the the folks that you work with will constantly be changing. I can probably tell you that I've worked with well over 1,000 people in my career, and they will still keep changing, and that's a good thing. So just talking about larger groups that give people the opportunity to collaborate together around interests around health IT. I know that you're a member of the New England HIMSS group. And how does that inform your experience as a teacher, but also what do you gain from that, and what do you hope happens for that particular group?
I've been a member of HIMSS for just over 15 years now and participating in different activities. And for the last 10 years, or about since I've been at Sacred Heart, an active member in the New England chapter of HIMSS. And I consider them to be extremely vital to our program, to our students' learning, and help us to shape the curriculum and continue to reshape it. And by that, I mean, there's been several times when I've attended the large HIMSS annual conference in the spring where I have either attended a lecture about a topic or had seen the exhibitor hall in terms of what new products are new to the market or coming to the market, and the way that informatics is being shaped by the market itself and by the needs. And so being able to see the trends, and one of them is a couple examples, I should say, are the addition of our population health course to our curriculum, which was not there when we first started in 2012. It was not or a topic. It was in its infancy. And so it became important as we began to collect lots of data in the EHRs through the meaningful use and EHR incentive period. And so I recognize that data analytics was a growing field within informatics, and items and courses such as pop health and others were new and expanding rapidly. And so being part of HIMSS has allowed me to recognize the trends and then include them in our curriculum. So population health was a course that was added after seeing the growth of that area and being part of New England, being part of the HIMSS, the national organization, and expanding and adding courses on data analytics and removing courses that were not as key to the curriculum. So our curriculum has essentially been, I think, somewhat of an organic nature, and it's been changing as and adapting to the field of informatics. And HIMSS has been really instrumental in guiding that, not only myself, but faculty. We are what's called a HIMSS organizational affiliate, as well as a HIMSS academic education partner, and that gives us access for all of our students as a student member to HIMSS, so they are also part of HIMSS as well, and providing that data and information for us and vital kind of guidance to keep, again, on top of things.
And so my guess is that you also have your students kind of get involved in internships and kind of practical learning experiences and things like that. And so tell us a little bit about that, and what organizations and what individuals involved in this field might be able to do in terms of collaborating with you on providing that experience, and then actually learning whether a student could be a good hire in the future.
Internships have definitely been important in our program and preparing students for the next step as professionals in informatics. I've been very fortunate to be able to partner with the very large health systems. There's 3 in Connecticut, Nuvance Health, Hartford Healthcare, and Yale New Haven Health System, and met with each of their CIOs and CNIOs, Chief Nursing Informatics Officer, to not only create internships, but also as part of other projects as well. They've often provided my program with the opportunity to bring somebody who was part of their team into a class to talk about a different topic, or to provide networking opportunities for the students. So internships and sort of part of the larger picture of having great partners has really added to the students' education. And specifically, internships have really given, and in many cases, the students have been hired by the internship site. So that demonstrates, I think, that they recognize the value of the student and what they're learning in our program, but also the value that the student can bring to the organization. So we're always looking for more internship sites. The challenge has been through COVID, where obviously we were in lockdown and many internships were shut down. Some organizations are bringing them back, but some are doing virtual work, and so it's been more challenging since we've returned back to the office, if you'll say, but not yet out of the COVID pandemic. But always looking for, and it's not just large health systems. If anyone is interested, I'm happy to talk about opportunities. We have also some agreements in place with some federally qualified health centers, some smaller health systems. So not just the large, but any of the areas that are all using technology now, and they all are. So no medium to large organization is not using EHRs in some way. So they have use for my students, for informaticists, and then my students as interns as well.
Wonderful. And just kind of shifting gears a little bit, as you and I both know, we're healthcare professionals, so we went through healthcare professional training. And how do you see the things that we've learned as informaticians being kind of embedded in actual training for becoming a healthcare professional, whether it's a physician or whether it's a podiatrist or even a nurse, right? What do you see as being important that we extend into that kind of training?
I think it's key that our future health professionals are educated about informatics in some way as part of their curriculum, whether it's med school, podiatry school. I mentioned PA, OT, speech, and I'm forgetting somebody. PT, OT, speech, and PA are major clinical programs here. And so it's true about any of ours, nursing and other allied, and all of our health professionals, because of 2 major sort of reasons. First of all, we know that technology is here to stay for healthcare. There's no doubt about it. But more importantly, it's been largely recognized the value that technology can bring to the healthcare field. And as I mentioned a couple of times, was back and sort of why we're doing this, which is for our patients' benefits. So educating our students that are in these clinical programs as to what they might see, again, sort of brings back the simulation area, which means that they get exposure to it before they're in their future careers and professions. And at Sacred Heart, what I do specifically is to actually spend a little bit of time each semester with the students learning or teaching them about informatics. So I lecture to them and talk with them, and we discuss the different ways in which maybe it's EHRs can be used in a clinical setting, or how telehealth has expanded throughout not only the pandemic, a little bit before, but mostly during the pandemic, and where we see technologies going. And then we touch on also topics like mobile health, mHealth, where our patients will be using technology through their smartphones and being a part of the healthcare team. So we like to think of our active engaged patients, though they're part of the healthcare team, the decision-making piece, with the value that mobile health will bring them, they'll be part of a stronger piece of the team. And so our clinicians need to know that our patient's going to walk into their office, going to see them, and often have some of the information already, having searched the internet for their diagnosis or what they think it is. But that we can leverage that and harness that so that they can take a key role in the healthcare team. So again, I think all of those are reasons why we need to educate our student clinicians sooner rather than waiting until they're actually out and have graduated and are working.
I totally agree. And I also think they can point out ways that we can, as healthcare informatics professionals, improve things so that there's less burden on them, because as we know, burnout from the burden of not having optimized health IT systems is a real thing. So let's take a moment and pause here, and then we'll be back after a few words from our sponsor, which is Connecticut's Health Information Exchange, or Connie. And then we'll talk a little bit more about how we might kind of think about the Health Information Exchange being part of your future collaborative work with students. We want to take this opportunity to thank Connie, Connecticut's official health information exchange. Connie was established in 2019 to oversee and provide services to support the exchange of health data in the state of Connecticut. Connie is an independent and not-for-profit organization. To learn more about Connie, please visit conniect.org or go to the show notes from today's episode. So coming back into the conversation, Steve, I'd like to really talk a little bit about something that's relatively new in our state, our Health Information Exchange, Connie, and it's been up and running for a little over a year now. And all the healthcare hospital organizations and labs are now required to connect. And over the next year, all practices that have a meaningfully certified EHR will also be required to connect. So as we think about that, we're now going into an ecosystem where healthcare data exchange is increasing substantially. What are your thoughts about leveraging that in your curriculum, in opportunities for interns? Kind of walk through what you're thinking and what you're doing in your setting.
Connie and HIEs it's a pretty exciting time for Connecticut, being that Connie is now up and running. I know there was some work in the past that was not as successful as more recently, but it's great to see that it's up and running and will have tremendous amount, if not complete, contributions across Connecticut for sending that data into and having it available for everybody. I mentioned about providing an overview of informatics to many of the healthcare programs in here at Sacred Heart. I always include a little bit about HIE because I segue from the value EHRs will provide to the we don't want silos of data, and how we answer that problem or solve that problem is with an HIE. HIEs are, and from the healthcare informatics curriculum, that's actually a course on our curriculum. We actually ran it a couple of times more recently. I want to tie it back to what I mentioned earlier about the sort of changing curriculum to match the landscape of informatics. And we actually had a HIE class when we first launched. It was designed in 2014, ran in 2014, and actually it wasn't run again until this past January 2022. And that was partly due to the fact that, well, we all originally saw when HIEs became a really important topic, the value of them. There was several challenges of HIE concept across the US as to why they were not always up and running as quickly or in place. They sort of stagnated in terms of their work. Some were stalled, and Connecticut's example that it was essentially paused for many years. But more recently, we've definitely in the state of Connecticut, but across the US, they've become more important as we've begun to figure out many problems and solve problems in healthcare informatics. And specifically seeing the greater value as we begin to and have been collecting lots of healthcare data and understanding the key piece that having an HIE will solve in taking care of our patients. We've actually reinvigorated, I'll put it that way, the HIE course. It was run online in the spring, and again in our in-person classes this current semester. We're in our late spring semester. And in fact, we have had the executive director for Connie as a guest speaker in the class, and she's been wonderful to provide the overview of the organization and the value of HIEs. So I think, again, it sort of demonstrates our curriculum is trying to be as current as possible, but also the value that HIEs, and because we see as a program the value of HIEs and what it can do for patient care. And so we'll continue to run the classes. I mentioned the Jen Searles, the executive director, has been wonderful to come in and talk to the students and providing them with sort of the really key pieces and parts of HIE general, and then specifically for Connie here in Connecticut.
So as I kind of think about the HIE landscape and why we're potentially having more likely successes now, one of the key things that has changed, besides policy and maturity of the actual electronic health records, is the real push towards having interoperable health data. Can you talk a little bit about how you teach in your curriculum about that interoperability and some of the more standard or more emerging technologies like Fire and Smart on Fire and things that are tools that can help in this sort of interoperable healthcare world?
The concept of interoperability is becoming more and more important as the amount of paper in healthcare reduces, meaning that everyone is moving to electronic world and in greater ways. And so the next sort of big problem to solve is how do we have everything interconnected so that a patient can tell one provider their allergies and that now populates all of their providers' allergy list, not having to have the patient repeat again and again takes up the patient's time. There is room for error. There's human factors involved. And so we do teach interoperability in a number of ways, whether it's Fire, whether it's a little bit about HL7, whether it's about XML, different standards. And in fact, we start with our intro course, our Foundations of Healthcare Informatics, which is a course that student takes in typically their first or second at the latest semester. There's a whole sector of the course that's focusing on the standards and interoperability. So things like LOINC, which is the lab value standard coding, the use of HL7, the use of interfaces, the use of HIEs. So how do we get the pieces connected so that we can exchange information and back to, as I mentioned, or preventing, I should say, as I mentioned, that silos of electronic data, which doesn't do anyone any good. Yes, it's great that we're now electronic, we're using EHRs, we're not on paper, but if those silos, those databases of data do not talk to each other, then we're not getting the full picture on our patients. And I often do an exercise where I show students the value of working as separately to solve a problem and then together to solve it, and how we can actually get to the solution quicker and better if we put our heads together, if we all work together in the same way.
Given the competitive nature of healthcare delivery in our state and others, that takes a certain a set of skills and desire to do it, as we know. Can you talk a little bit about some of the unique opportunities you see with a health information exchange and some of the unique challenges you see in our particular state?
So opportunities certainly are a couple. I think the biggest value and opportunity for HIEs is around that coordinated care. And so I had mentioned the exercise I have in class is essentially a version of the game Clue, where the students each have a set of about 6 clues, and their job is to figure out the who did it, where, and the weapon that was used. But I cleverly created the assignments such that there are actually 13 clues in the game, and I give each one 6 different clues, and there actually are 5 different versions of this document I passed around the room. And students are often very good at being a student, which is I'm not looking at anybody's paper because this is a quiz or some kind of test or whatever, and they don't collaborate with the students around them, and they're not able to solve the problem or come up with a solution to the mystery. And I give them a couple minutes to struggle, and I watch a couple of times where students start collaborating and they start laughing because they realize they each have a different version of the clues. And sometimes that starts percolating through the classroom, but often it doesn't, because again, students are taught to be good students, which is not to look at anybody's paper but your own. And so I let the exercise go on for a bit and then stop them and point out what's going on, which is that they don't have enough clues. And I equate that to not having all the data, all the information on our patients. So yes, you've got 6 clues and you can work to figure it out. Yes, you have an EHR where you have lots of information about your patient, but if you don't have all 13 clues, then you're not getting the full picture on your patient and how can you give somebody really good care without all those clues. And so again, that's the value, that's the value that HIE brings. There's also related to research and some others where having large data sets are really key to solving some of the healthcare issues. The challenges certainly are a couple, sometimes technical in terms of how do we get the pieces and parts to talk to each other. Sometimes I'm probably more about related to regulations, related to different statutes, maybe at the state level or federal level, and how do we get around those? Sometimes around the sensitivity of information, such as mental health or behavioral health information, and the policies which need to be addressed around those. So sometimes, and it's more challenging on the policies and procedure piece than it is the technical piece, but definitely challenges of HIEs. And then I think part of it is the ongoing question of the cost and the support in terms of this is a technology which needs to be funded in some way, and how is that problem solved? How do we address the ongoing need to support this technology, this very valuable technology, but how do we do that is certainly one of the biggest challenges around HIEs.
Yeah, I agree with you. Those are all, valid, challenges and also good opportunities for us to actually improve patient care. And I think that's why we're all in this, is to sort of make patient care as effective and as seamless as possible, but also to make it as smooth on the providers and as optimal on the healthcare organization, so that we're not wasting time and effort. So in thinking about that, do you have any kind of words of wisdom or final statements for our listeners that comes from your perspective?
So the important thing I would say that to anyone who's listening about healthcare informatics and HIEs and the value of technology is that it very much is I think of it as a collaborative, might be a team sport. And that means that, and really what the key piece of informatics is and healthcare informatics is as I mentioned sort of early on, which was how we put technology into healthcare. And what I stressed many times with my students is that it needs to work for the clinicians and it needs to work with their workflow, not the other way around. And as best as we can do that, as best as can happen, that's what we need to, as informaticists, do and achieve. It is very much of a collaborative set of work. If you look at many informatics departments, if you look at many informatics projects, they're often a team approach to those that are on the clinical side, meaning direct patient care typically, and those who are on the informatics side. And many of those on the informatics side have a clinical background and transitioned as myself to the field of informatics. And so we can put the two together. But there are many other team members that don't necessarily have a clinical background, who are problem solvers, who have come against an issue and know how to solve the issue. But it very much is about coming together, looking at a problem, applying a technology solution, adapting that solution to those who are going to be using it to address the issues of specifically around patient care, as I've mentioned, but more broadly around healthcare. So we all know that healthcare is an expensive proposition, that we're trying to bend the cost curve. And the goal is, how can we give better care and also at the same time address the larger issue of the cost of healthcare? And I do truly believe that it is the application of technology to this problems that are occurring in healthcare that we can achieve those goals.
And I do think we are moving that way. Sometimes it feels like, one step forward, half a step back, or two steps forward, one step back. But I do certainly think that we've made some major advances and will continue to do so. And I think that your program and others like it that train professionals in sort of cross-cutting and collaborative ways about how to improve our technology in use in healthcare is really a key piece of that. So I look forward to kind of collaborating with you personally more as time goes on, but also having our healthcare professionals get trained a little bit more in the informatics side, and our health informatics folks get trained in collaborating with our programs and our clinicians, and also with our HIE in the state. So thank you so much, Steve, for the time and effort you put in today, and look forward to continuing our relationship with as colleagues.
Thank you. And thank you to everyone who's listening to understand the importance of education in informatics. We certainly are, it's key to the future of healthcare, as we have mentioned, as well as the field of informatics as well.
As always, wishing you the best of health. Your host, Tom Agresta.